Hey, you guys, welcome back for another week of Work It Out Wednesdays. On Wednesdays, we work out practice questions to test our knowledge on what we have covered for the week. This week, we discussed beta agonists and muscarinic agents. So I have a few questions for you to test your knowledge. All right, let's get into the first question. First question states, a nurse practitioner student is working with her preceptor at the office today. They are discussing treatment plans for a newly diagnosed COPD patient. The preceptor mentions to the student that a SABA will need to be initiated PRN. What response shows the student's appropriate understanding? Is it A? Okay, let's start him on salmeterol PRN. B? Okay, let's start him on tiotropium PRN. C? Okay, let's initiate albuterol PRN. Or D? Okay, let's start ipratropium PRN. And I'll give you a moment to think on this. Put your answers in the comment and tell me what you have, okay? All right. As always, I tell you guys to read the stem of the question first so that you can ensure that you are answering what they are truly asking. So the stem of the question states, what response shows the student's appropriate understanding? So we're trying to make sure that we have a correct answer from the student. So the preceptor has mentioned to the student to start a SABA PRN. So we need to see that the student knows what a SABA is. So when you start to think about this, we know a SABA is a short-acting beta agonist. So which one falls into that drug class? Is it A, the salmeterol? No, because that's a LABA, right? Is it B, tiotropium? Nope, that's a muscarinic agent, right? C, albuterol? Yes, the answer is C. Let's initiate albuterol PRN. Albuterol is your is the most common SABA, I should say. It's a short-acting beta agonist. It's our rescue inhaler, the most common utilized, and this is what we give everybody PRN for potential COPD exacerbation and our asthma population in case of an asthma attack. Okay. All right, let's head to the next one. All right, so now I'm just going to do a few matching because I just want to test your knowledge on these drug classes. I did a little bit different this time. So let's match the medications with the drug class. So albuterol, also known as Ventolin or Provençal, which drug class? And you should know this one. We just discussed it. Sasaba, short-acting beta agonist, right? All right. How about tiotropium, also known as Spiriva? What you got for that one? What drug class is that? That's a llama, right? A long-acting muscarinic agent or antagonist. How about salmeterol, also known as Zopanex? What drug class do you have for this one? Tell me what you got in the comments. Let's see how you do. And it's a LABA. It's a long-acting beta agonist. Remember when I told you to think of the SABA, the B in SABA, as B for basic, B for buterol. So albuterol, levalbuterol, and then for the long acting, I told you to look at the M in the metarol. The metarol meaning more, M for more because we needed more, a longer standpoint of time for coverage from the medication, right? Next, we have our ipratropium, also known as Atrovent. Which drug class is this? Hypertropium Atrovent is a short-acting muscarinic agent, right? A SAMA. So remember with our muscarinic agents, we have the short-acting and the long-acting. I told you with the short-acting, we have an ending of tropium. Let me go back so I can show you what I mean. So just that ending of tropium, tropium, whereas with the long-acting muscarinic agent, it is tiotropium, the long word. So it's a little bit longer in spelling, I should say. But those are just my tips. Go check out the video from yesterday on topics and tips to see if that can help you a little bit with retaining it. Continue to study and practice. Write those down. I just like to do this to kind of test your knowledge, get it ingrained in your mind, helping you with your studying. If you're on the go listening to this, to kind of help reiterate and have that repetition to get it in there. The more you do it, the more you have it. Practice it and makes perfect, right? But as always, you guys, thank you for watching. Be sure that you like, comment, and subscribe. And be sure to share with a colleague or friend or whomever you may feel that can find this helpful. And meet me back here next week for another practice question. Bye, y'all.